Hi everyone, this is Andre. Today we're going to talk about bloodletting treatment. So I'm going to talk about who is it for and what is it for. So when you think about bloodletting, maybe you were thinking about, back in 16th or 18th century, people in Europe where there was something called bloodletting treatment, which was they insert injection needles through your vein and let out 100, 200, even 400, 500 cc's of blood to treat people to make them feel better, but it actually end up killing those patients because they lose too much blood. This bloodletting treatment is completely different from that. It's more of a traditional Chinese modality. So first, let's talk about who it is for. So first of all, you have to have a strong body type. So someone who's rather younger than older, who has like a bigger body and dense muscle, rather than someone like me, slender, not too much muscles, or if someone who's much older or much weaker, doesn't like has a small voice and talk, like by talking this person might go out of breath. These are the weaker person that's not suitable for this. The stronger type of people would tend to have bigger voice, like a loud voice and lots of energy. Like I said, dense, really dense, big muscles, much bigger body type. So these are the people who, what I meant by strong body type. And then blood stasis, this kind of ties with the strong type as well. So blood stasis means the blood flow is not very smooth, so it can cause congestions or slow flow or sluggish in the in the veins. You might see this type of people with varicose veins in their legs, or a lot of purple spider veins on their body. So these are the results of your body trying to compensate with slow or sluggish blood flow. And the third type of people would be when someone has an acute condition. For example, if someone has a stroke and they are unconscious, or another acute condition would be like, for example, you are doing sports and you sprained your ankle and it's swollen. The next thing would be a local treatment. For example, if you have if you have knee pains going up and down stairs, we can do some local bloodletting to improve the circulation in the area to help reduce the pain. So let's talk more in depth about these things, and I'm going to show you the tools that I normally use and how I use them and what they are for. So generally, bloodletting, there are two types of bloodletting. So one, we do a prick on one of those spider veins to let the blood come out. And normally the blood that's in the spider veins has been there for a long time, and it has lost its coagulation function, so it doesn't stop bleeding that well. So once these type of blood that runs out, the new blood comes in to take its place. The color will be much brighter, and it has proper coagulation function that the bleeding will stop when this fresh blood comes in to take the place of the old blood. So if you imagine this is a vein, a spider vein, the purple spider vein, that's has a lot of blood in there. It's not going back to the heart as fast as it should, and they will get accumulated here. So once we do a kind of tiny prick, the blood that's here will come out, and once the old blood comes out, the new blood can come in to take its place. The bleeding, the function of the blood will be restored, and the bleeding will stop by itself. So, and so the tools that I use for this, there are two types. One that looks like this. So it's a blood lancet for diabetes patients when they want to check their blood sugar. So you just twist off the cap, and you can see a tiny needles there. So you kind of prick that into the purple spider veins, and some blood, maybe a couple drops or a stream of blood will come out depending on how big of a vein that is. And once you're done, just kind of poke it back to the cap so nobody will get infected by picking up the garbage or accidentally touching the garbage bag. And there's the second type, which has slightly bigger tip. So that's what it looks like. And these comes individually packed like this, and they are also called blood lancet. Sorry, the focus is not so great. Anyway, so it has a slightly bigger tip than what I just showed you. Sure. Can you see that? So this type of tip will have more blood coming out of the veins. So I normally use that on the. I should say I only use that on the purple veins. We don't do it on the varicose veins because one, it's not the therapeutic effect of poking varicose veins is not as good as poking the purple veins. And two, there are a lot more blood in the varicose vein than the purple spider veins. So the reason why we form these purple spider veins is because our major veins has too much blood in it. Sorry. And the purpose of veins is to have blood going back to the heart. So when this power of blood going to the heart is not strong enough, the blood will start accumulate in the vein. And your body is trying to help itself by growing new veins to release the pressure and to help with the blood flow going back to the heart. So that's why people have those purple veins, especially in your legs, because that's the farthest away from the heart and has the most weight of blood. And in the veins there are these valves, one direction valves, that only allows blood to go towards the heart, not away from the heart. But when there are too much blood in the veins, these valves will lose their function because they're too heavy, and now you end up with kind of protruding veins, and they are the varicose vein. So you can see on the skin, you can see like a warm like a surface. You can like look like that. Sorry. You see bumps and dips everywhere on the skin along the vein. So that's called varicose vein. So the next type of bloodletting is done on areas without these purple veins. So for example, if you have, if you sprain your ankle on doing sports, and it's swollen like a tennis ball, what we normally do is we bleed the local area where it's swollen to help release the pressure and restore blood flow in the area to help it heal faster. And that's a type of acute condition that I mentioned. And if your family or your friends who happen to have a stroke in front of you and they are unconscious, there's a type of bleeding that you can do. Is what you do is you grab a sewing needle or any type of sharp needle, or if you have those blood lancet, you grab the person who was unconscious, their hand, like grab it like that, and use one hand to grab it, and use the other hand with needle to poke a hole on the fingertip, on each fingertips, and you squeeze like that to squeeze out some blood on the 10 fingers. That will reduce. That will kind of, it's a acute emergency treatment in Chinese medicine to help restore the consciousness and also reduce the blood pressure in the brain. So if someone has a stroke or some suddenly become unconscious, and this is a good emergency treatment before the paramedics arrives. So when emergency happens, if you know this method, you can help your friends or your family rather than waiting, because sometimes an ambulance will take 10-15 minutes to get to your place. By the time, it might be a little bit too late. If you did 10 fingers and the person is still unconscious, you can do the feet as well. You can do the toes, and same method, you poke each toe and squeeze out a couple of drops of blood from each toe and each finger. And the last thing, the local treatment is generally, it can be these two types as well. If you see a purple spider veins, then you can do that. If you don't see the purple spider veins, you can, what I normally do is I palpate for tender spots, and then I prick those tender spots with a safety lancet like this. I'll show you the box. So it looks like this, and this one is a very good invention because it's practically painless when you use this. Diabetes patients, you can also use this to check your blood sugar, sorry. So what you do is you open the tip, and it looks like that. This is, the blue thing is a push button, and if you press it, when you have the tip located on the skin, the needle will come. There's a spring in there, so once you press it, the needle will jump out and retract very quickly, like in a split second. So people don't feel anything when you use this. It's a very good tool for pricking areas without veins, because without veins you don't need the precision. You just need like a approximate location. So I use about 3 to 4 of these. Then I put a disposable suction cup. This is sterile disposable suction cup onto the area where I just pricked, and place it on the top of a suction gun, and then do a few pumps, and there will be suction in there, and leave it about 3 to 5 minutes. Let the blood come out a bit, and then I dispose it. Then I dispose this, so there's no risk of infection doing that. Okay, so it's good for so this type of treatment is very good for knee pains or acute injuries, or someone who has high blood pressure. What else? Or like a local type of neuropathy. So last year around this time, I had a patient with foot pain with like a neuropathy issue with like a really pricking pain under the on the sole of his feet, and he was one of these strong body type of patient with blood stasis. So after about 5 treatments of bloodletting, he was fine, and he was back to normal again. And until this point, he doesn't have any problem. So that's it for today, and I hope you learned a little bit today and have a better understanding of what is bloodletting treatment and what it's for and who they are for. So I'll see you next time. Bye.